The rising tide of disease, floods and health in Bangladesh. Bangladesh, a land of rivers and deltas, is no stranger to floods. Every year, the monsoon season brings with it the threat of rising waters, submerging vast areas of the country. These floods are not just a natural disaster but a recurring event that impacts millions of lives. These floods bring a silent and invisible threat, disease. As the waters rise, they infiltrate homes, schools and hospitals, making it difficult for people to access clean water and sanitation facilities. Contaminated floodwaters create a breeding ground for bacteria, viruses, and parasites. Waterborne diseases like cholera and typhoid fever can cause severe complications. Vector-borne diseases like malaria and dengue fever thrive in stagnant water. The health infrastructure is often overwhelmed, struggling to cope with the surge in patients. Preventive measures and timely medical interventions become crucial in mitigating the health impacts of these floods. The resilience of the Bangladeshi people is tested every year, as they battle not just the floodwaters, but the diseases that follow in their wake. Flood-borne diseases, a threat to life and well-being. Floods create a conducive environment for a variety of diseases. Waterborne diseases spread through contaminated water, causing symptoms like diarrhea and fever. Stagnant floodwaters breed mosquitoes, spreading malaria and dengue fever. Respiratory infections can spread easily in crowded shelters. Prolonged exposure to floodwaters can lead to skin infections. Recognizing the warning signs of flood-related illnesses. Symptoms of flood-related illnesses can vary widely, but early detection is key to effective treatment and recovery. Timely recognition of flood-related illnesses is crucial. Being aware of the symptoms can help in seeking prompt medical care. Gastrointestinal issues like diarrhea and vomiting are common symptoms. These can lead to severe dehydration if not treated promptly. Fever, chills, and body aches can indicate malaria or dengue fever. These illnesses are often spread by mosquitoes in flood-affected areas. Respiratory distress such as cough and chest pain can signal pneumonia. This is especially dangerous for young children and the elderly. Skin changes like rashes and redness should not be ignored. These can be signs of infections or allergic reactions due to contaminated water. Seek medical attention if you experience any of these symptoms. Early intervention can prevent complications and improve outcomes. Section 4. Seeking treatment, your path to recovery. Prompt treatment is essential for recovery. Rehydration therapy is crucial for waterborne diseases. Antibiotics treat bacterial infections like cholera and typhoid fever. Anti-malarials are used for malaria treatment. Supportive care manages symptoms of viral infections like dengue fever. Additional treatments may include oxygen therapy and wound care. Section 5. Protecting yourself and your loved ones. Precautionary measures. In times of crisis, taking the right steps can make all the difference. Prevention is better than cure. Being proactive can save lives and reduce suffering. Consume safe drinking water by boiling it for at least 1 minute or using purification tablets. This simple step can prevent waterborne diseases. Practice good hygiene by washing hands thoroughly with soap and water, especially before eating and after using the restroom. Keep household surfaces clean to minimize the spread of germs. Eliminate mosquito breeding sites by removing stagnant water from containers around your home. Use insect repellent to protect yourself from mosquito bites, which can transmit diseases. Wear protective clothing such as waterproof boots when wading through floodwaters to avoid infections. Ensure vaccinations are up to date to protect against diseases like tetanus and hepatitis. Avoid contact with floodwaters as much as possible. Floodwaters can be contaminated with harmful bacteria and chemicals. Heed warning signs and stay informed about the latest safety advisories. Section 6. Building a healthier future, community awareness and preparedness. Combating health risks requires a collective effort. Conduct educational programs about flood-related health risks. Ensure access to clean water and sanitation facilities. Establish early warning systems for impending floods. Train community health workers to provide basic healthcare services. Develop disaster preparedness plans to manage health risks.